Hi, my name is Pat Iyer, and I am the editor of the Medical Records Analysis book, Volume 4. I'm delighted to introduce to you Susan Haibeck, who is one of our authors. She is an oncology nurse and a legal nurse consultant, and she is also the author of a book on cancer care malpractice. Susan, please tell our viewer the topic for this chapter in the book.
Thank you, Pat. The topic of my chapter is lung cancer, current litigation approaches to an old problem.
And why is lung cancer such an important issue for attorneys and legal nurse consultants to focus on?
Correct. It's important for them to focus on because lung cancer is the number 2 diagnosed cancer, both men and women, for 2025. There will be hundreds of thousands of people diagnosed with lung cancer, and there's a lot of opportunity for error across the cancer care continuum from diagnosis to hospice. So there's room for mistakes in reading the x-rays and in communicating the reports, and that's what we see most of is the failure to diagnose or timely diagnose. And sometimes we'll see some chemotherapy cases also, specifically errors in there are missing chemotherapy information, records missing, that kind of thing.
So it's a common type of cancer you've mentioned, and then lots of room for error. And what I think about is that although there are some better therapies now than there used to be, it still is a type of cancer that's hard to cure.
Yes, it's a low 5-year survival rate. It certainly is. So that the trick is to catch it at a stage 1A or 2, and that would mean you have to be screening people, high-risk people with CT, with the low-dose CT scanner, and then monitor from there properly. We've had cases too where people were diagnosed with pneumonia. Once the pneumonia cleared up, lo and behold, there's lung cancer behind it.
I was just having a conversation with an emergency department physician not long ago who talked about those findings in the emergency department when a cancer shows up on an x-ray and then no one follows up with the patient. He called it a incidentaloma, right?
Correct.
You know that term. That was
yes.
a new term.
Incidental finding. Yes.
Incidentaloma. Yes.
Yeah, very good. The OMA.
You'll have an opportunity to read Susan's chapter in the Medical Records Analysis book, Volume 4. Go to the link directly below this video, LNC.tips/MRA4, and get your copy of the book.
Thank you, Pat.